Hello, I'm Dr. Amreen Singh. Today I will talk about the fibroids. Fibroids are very commonly found in the African females. But usually whenever the diagnosis of fibroid is done on ultrasound, females they get scared that they will not be able to conceive. But it is not like that. Even with fibroids, any female can conceive. The conception in females with fibroids that depends on the number of fibroids, the site where the fibroid is located, and the size of the fibroid. So whenever there is a diagnosis of fibroid, first of all, it is determined whether the fibroid is inside the uterine cavity, the fibroid is outside the uterine cavity, or it is in the wall of the uterus. So these two things, one is the location and one is the size of the fibroid. So these two things are determined and then the treatment modality is thought of. So whenever there is a fibroid outside the uterine cavity and its size is lesser than 5 or 6 centimeter, then there is no need for the treatment. But if the fibroid is bigger than that, that is 7 to 8 centimeter, then your doctor may advise you to undergo myomectomy. And then in cases where the fibroid is inside the wall of the uterus, that is intramural fibroid, and the size of the fibroid is very big and that is also disturbing the endometrium lining of the uterus, then definitely your doctor will advise you to remove this fibroid first and then go ahead with your treatment for the pregnancy, which may be IUI or which may be IVF, and it gives high success rate. And in the third type of the fibroid, where the fibroid is inside the uterine cavity, that is submucosal fibroid. So any kind of submucosal fibroid is always removed, because if the fibroid is inside the uterine cavity, that will definitely affect the chances of pregnancy, because the implantation capacity of the endometrium lining is disturbed and that may lead to failure of your chances of pregnancy. And even if you undergo IVF and there is a submucosal fibroid, the embryo will not implant, and even if it gets implanted, there may be chances of abortion. But all these things can be prevented if the fibroid inside the uterine cavity is removed before doing any kind of treatments of the pregnancy.